Welcome to Niagara Health and congratulations on your upcoming birth of your child.
Our state-of-the-art Women and Babies unit is located at 1200 4th Avenue in St. Catharines.
My name is Cindy and I'm a registered nurse in the Women and Babies unit.
And my name is Cheyenne, Indigenous Community Outreach and Engagement Specialist with our Indigenous Health Services and Reconciliation team.
Niagara Health is honored to provide care on lands where Indigenous people have lived for thousands of years with their own unique cultures, identities, and languages. These lands are steeped in rich history of the First Nations such as the Attawandaron, the Haudenosaunee, the Anishinaabe, and the Mississaugas of the Credit First Nation. There are many First Nations, Métis, and Inuit peoples from across Turtle Island who live and work in Niagara today. We are committed to listening and learning more about the history and current experiences of Indigenous people and acknowledge our responsibility to take meaningful action towards reconciliation in our healthcare system.
The goal of this video is to give you a glimpse of what you can expect when giving birth at our hospital.
Patients and their babies are cared for by our passionate and dedicated healthcare team in our bright and spacious family-centered facility. We are a proud teaching hospital. With your permission, students and residents may be present during your stay with us. It's always your choice and has no impact on your quality of care. During your pregnancy, you may find it useful to access our available resources on our Niagara Health website under Women and Babies. These resources include a labor and birth plan, options to keep you comfortable, and special requests for religious and cultural practices. If you think you're in labor or have any concerns for yourself or your baby, please present to the hospital for assessment.
If you're coming to the hospital between 7 a.m. and 11 p.m., please enter through our main entrance located beside the Walker Family Cancer Center, facing First Street Louth. Please use the emergency department entrance between 11 p.m. and 7 a.m. Paid parking is available on site with full day and multiple day options. Please contact our parking services for all available options. Once inside the hospital, continue straight past the cafeteria and take the main elevators to the Women and Babies unit on the 4th floor. If needed, wheelchairs are available near the front entrance.
Proceed down the hallway to triage and ring the bell. A nurse will greet you, introduce themselves, and ask you about your pregnancy and what brings you to the hospital. Our triage area is made up of 6 beds with a chair available for your support person. Here, the nurse will assess you and your baby, listen to your baby's heartbeat, and take your vital signs. Patients are seen on a priority basis, not on a first come, first serve. This ensures the most acute patients get the care they need first. During triage, the doctor on call or midwife will meet you and assess you and your baby. Depending on your assessment, you may be discharged home, asked to stay for further reassessment, or you may be admitted to the hospital. If you are in early labor, it is completely normal to be discharged home and asked to come back later. If this happens, we will provide you with clear information about when to return to the hospital and how to cope at home. When you are admitted, your nurse will take you to your labor and delivery room and begin the admission process. This includes assessment, blood work, and an orientation to your room and our unit. If you are having a planned cesarean birth, your physician will pre-schedule your surgery date. Please arrive to the unit 2 hours prior to your surgery time. Once you arrive for your scheduled C-section, your nurse will take your vital signs, listen to your baby's heartbeat, complete your blood work, and set up your IV. Having a support person during labor can provide emotional support, comfort, assistance, and positively impact the overall birthing experience. If you are having a scheduled cesarean birth, one support person is welcome to stay by your side throughout your surgery. Any changes in this plan will be communicated to you and your support persons. We understand that this is an exciting day for your family and friends. For the most up-to-date visitor information, please visit our website. In the delivery unit, you will find a small kitchenette that you're welcome to use. The kitchenette includes a water and ice machine, fridge, kettle, and microwave. We also have a Tim Hortons and cafeteria on the main floor of our hospital. Labor can take a long time. It's important that your support persons take care of themselves so they can continue to help you. During your stay, your healthcare team will be your #1 resource for guidance and encouragement for you and your support persons. Your nurse will communicate regularly with the on-call care provider to coordinate care. As your labor progresses, we have a number of different options to help you cope and keep you comfortable. This could be massage, bath or shower, exercise ball, peanut ball, or medications such as narcotics or epidural. Your nurse will help you in accessing these supports. Talk to your doctor or midwife to plan your options.
Niagara Health has Indigenous Health Services and Reconciliation team that will identify and act on priorities that ensure inclusive, equitable, and compassionate healthcare journeys for all Indigenous patients and their families. Any patient or family member can request a smudging ceremony during their stay. To request a smudging ceremony, please speak to a member of your care team. The staff member will then notify the Indigenous Health Services and Reconciliation team to facilitate your request.
At Niagara Health, we have 17 private labor rooms. This is where you will give birth and stay for the first few hours after delivery. On postpartum, we have 1 ward room, 3 semi-privates, and 10 private rooms. You will have the opportunity during your stay to request your preferred postpartum room. Every effort will be made to provide you with the room type you request. Room assignments are based on bed availability and medical necessities of our patients. For your comfort, each labor room has a private bathroom with a shower and a pull-out chair for your support person to sleep on. Once you give birth, your baby will be placed on your chest for skin-to-skin. Your partner will also have the opportunity to do skin-to-skin contact after your baby is born. We recommend continuing skin-to-skin for at least the first hour after giving birth and continuing for as long as possible throughout your hospital stay. Skin-to-skin is the best way to soothe and calm your baby, bond with your baby, regulate your baby's temperature and respirations, and encourage effective breastfeeding. If you choose to breastfeed, our trained staff will encourage and facilitate breastfeeding within the first 2 hours after your baby is born. You may also choose to meet with a Niagara Health lactation consultant during your stay. A few hours after delivery, you and your baby will be transferred to our postpartum unit. If your baby is premature or requires a higher level of care, they will be cared for in our neonatal intensive care unit, also referred to as the NICU. Our NICU is the only NICU in the Niagara region. It is a 20-bed unit that is designated as a Level 2C facility, taking care of newborns 30 weeks and above. The NICU is located in close proximity to our Women and Babies unit, and we encourage parents whenever possible to stay with their baby for the duration of their admission. Identification bands will be placed on you, your support person, and your baby once baby is born. Please wear your ID band during your entire stay. Your care team will check your ID band prior to any procedure, transfer, or administration of medications. Once you are transferred to a postpartum room, your family and friends will be able to join you and meet your new baby. Safety is our top priority. At Niagara Health, we have an infant security system to ensure the safety of your baby while in hospital. Your baby will stay with you at all times unless there is a medical reason this cannot be done. This will give you a chance to get to know your baby and their unique behaviors. The first 2 weeks after baby is born is a time of excitement and change. There will be many adjustments to make and lots to learn. There are many services available to support you during this time. The day you go home, your care team will ensure you have information about resources in the community and who to call if you have any concerns. A public health nurse from Niagara Parents will come and see you during your hospital stay. During this visit, they will provide you and your family with information on supports in your community. Niagara Health social workers are also available to provide counseling, support, and information to help you plan your return home. They can also connect you to resources in your community for continued support. Before you know it, it'll be time to go home. You can expect to go home 24 to 48 hours after giving birth or earlier if you're under midwifery care. Please ensure you have reviewed and installed your infant car seat before discharge. Car seat clinics are available within the Niagara region. You and your baby will have a follow-up appointment with your primary care provider in the community. We will make sure you are aware of any follow-up appointments you may have prior to discharge. We hope we have helped you answer some of your questions about delivering your baby here at Niagara Health. Remember, you as the parents are the most important persons in your baby's birth. We are here to help you have the best birthing experience possible. And again, congratulations and see you soon.